There is a new illness called COVID-19, which has spread around the world. It is caused by a coronavirus. Viruses are tiny particles, much too small to see, which spread from person to person. There are no medicines to cure COVID-19. While most people recover, some people get very sick and die. That is why we all need to help to stop the virus from spreading by making changes to how we live. The new coronavirus spreads easily. A person with it can spray millions of virus particles when they cough or sneeze. This is why we need to stay a bed length from each other. The virus can stay on doors, taps and other objects for several days. If you touch them and then touch your mouth, nose and eyes, you can catch it. That's why you need to wash hands with soap and water for 20 seconds. Find ways to greet people without shaking hands. And if you cough or sneeze, use a tissue or catch it with your elbow. Do not spit. If an infected person passes the virus on to 3 others, who then pass it on to 3 more, in a few days a whole village can be sick. If someone has symptoms, they and their family should stay at home so we can slow the spread of this virus. The symptoms of this illness include cough and fever, headaches, body aches, chest pains and tiredness. Some people lose their sense of taste and smell. Many people only get 1 or 2 symptoms and are not very ill. They might not even realize they are infected, but they can infect others who might die. Some people get all the symptoms and become very sick. If someone has trouble breathing, they need immediate expert medical advice. The illness becomes more serious with age. So someone who is 50 is much more likely to become seriously ill than someone who is 20. Those at higher risk of dying include people over 60 and people with medical problems like diabetes, high blood pressure, heart problems, or untreated HIV. People with HIV who keep taking their medicines and have no other medical conditions are not thought to be at high risk. People in high-risk groups should sleep and eat separately from other people. By separating themselves, they reduce their chance of getting sick. It may save their lives. It is rare for young people and children to get seriously ill, but they can pass on the virus. This may kill elderly parents, grandparents, or friends who have other health problems. Try to stay at home. If you go out to collect food or to work, you should be extra careful and stay 2 meters away from other people. Use a mask and don't touch your face. Masks made from cloth must be washed frequently. When you return to your house, wash your hands and remove and wash your mask. Wipe plastic bags or other objects before you take them into the house. You can use water mixed with bleach or detergent if bleach is not available. Because some people do not get symptoms, it is impossible to know who has the virus and who might be spreading it. It can be difficult to stay apart from people, but this is the best way to stop the spread of the virus. Try to keep your house well ventilated. Please wash your hands regularly and remember to keep a bed length apart from people. Remember, if someone in your home is unwell, you should all stay at home. Thank you. This will help save the lives of people we love.